Hello and welcome. My name is Tim Lewis, and I serve as the Community Impact Director for the American Heart Association throughout Northwest Ohio. I'm going to host and moderate our community conversation today. And we've been hosting these community conversations for a couple of years. And in these conversations, we've had some really excellent discussions on important and relevant topics and have had really great turnout for people and have gotten really positive feedback from participants requesting additional topics. So trying to continue to host these conversations in order to discuss topics that are important to the health of the community and in ways we can help everyone in the community live longer, healthier lives. Right now, we're going to have a conversation much on stroke and preventative medical care and how stroke is diagnosed and how stroke is treated. An emphasis on stroke awareness and risk factors. Thank you for joining, for being part of the conversation. I'm fortunate to be joined. I'm going to allow our physician expert to introduce himself.
Hi, good morning, everyone. My name is Dr. Eamon Gaith. I am a physician whose training is in neurology. I also did my subspecialty training in vascular neurology or stroke, and I did neurocritical care training as well as neurointerventional training. Well,
excellent. Thank you for joining us, Doctor. And today's conversation is brought to the community with local support from Mercy Health St. Rita's Medical Center. And so let me kind of start with this. Heart disease is still the #1 killer of Americans and worldwide, and stroke is the #5 killer in America and the #2 killer globally, as well as a leading cause of preventable disability. We want to take every opportunity to better understand stroke. To start, can you just kind of give us a basic overview of what a stroke is?
Sure. So, a stroke is it's a very broad category. There's two main types of strokes. One bleeding type of stroke where you have a rupture of an aneurysm, or you have an artery that has ruptured in the brain causing bleeding. The second and vastly more common type of stroke is the clotting type of stroke, where a blood vessel is blocked and it causes death to the tissue of the brain distal to the blockage of the blood vessel. And that's usually the most common. I would say about 80 to 85% of the time, it's going to be the clotting type of stroke that people have. And about 15 to 20% of the time, it'll be the bleeding type of stroke.
Okay. Thank you. And so what are some of the warning signs and symptoms of stroke?
Okay, so, and just to take a step back, I know with heart health, it's important, and we know that the community members know that, if a person is having a heart attack, you should take aspirin and then go to the hospital. Stroke is a bit different because at that time, when you're having symptoms, you really don't know whether you're having the bleeding type of stroke or you're having the clotting type of stroke. And so we definitely do not recommend you to take aspirin if you're having stroke symptoms, because if you end up having the bleeding type of stroke, you're going to make your symptoms worse because aspirin can cause the blood to become more slippery. Okay. Typically, what I tell folks is you want to remember FAST. Okay, if you or a person you love's face is drooping, if their arm is weak, if their speech is jumbled or garbled, or they're not making sense, it's time to call 911. Okay, and it's important to remember that you definitely want to call 911, and you want to have the ambulance folks pick you up and take you, because a lot of the protocols that we have set up, especially at St. Rita's, start from EMS. So when the ambulance drivers are there, they're picking you up, they send us a message to the hospital saying that we have a potential stroke candidate. What that does on our side is it frees up an emergency room team to meet you right at the door. Our neurology and stroke team is ready. The CT scanners are emptied, and so it becomes a fast track process to take you directly from the doors of the emergency room all the way to CT. And we have to make a series of very rapid but very important decisions, because stroke is a time-sensitive disease. Every minute makes a difference.
So FAST, F for face, A for arm, S for speech, and T for time. Time, not only do minutes matter, but seconds matter.
Yes, and I would really request from everyone listening, again, stroke is a time-sensitive disease. I've had plenty of patients that tell me I started having symptoms the night before, but I wanted to sleep it off and see what would happen. You do not want to do that, okay? We can do amazing things in stroke care at the hospital, but if you get to us too late, there's nothing we can do, okay? The sooner you get to us, the better of a chance you have of recovering from the stroke you're having.
Excellent. Thank you. So quick, I guess, question on those strokes warning signs and symptoms. Do those warning signs present differently in men or women or by age group, or are there any subtle differences in how those symptoms present?
Well, not typically when you're having stroke symptoms, it's because there's a certain area of the brain that's being affected. Okay. Now, as we get older, our risk for stroke increases. If we have risk factors like high blood pressure, or we're diabetic, or we have high cholesterol, or we smoke, or we have a sedentary lifestyle, or there's truncal obesity, all of those are independent risk factors for having a stroke. But typically, it really depends on what area of the brain is affected. And that really will dictate what type of symptoms a person has. In general, what I tell folks is, if you're having symptoms on one side of the body, no matter what those symptoms are, you have to worry about stroke. You have to call 911. You have to come to the hospital. If you're having vision loss in one eye, that is also considered a stroke. Okay, you have to come into the hospital for that. The sooner you come to us, the better your chances are of surviving and of turning to normal.
Excellent. So you brought up the risk factors. Can you just give a basic overview of what of stroke risk factors, and what does it mean for risk factors to be controllable and versus uncontrollable?
Sure. So the main risk factors that affect your quality of health are the same ones that affect your heart health. Okay, which namely are high blood pressure, diabetes, and high cholesterol. Now, the issue with high blood pressure is it doesn't cause pain, so people tend to not take it as seriously as they need to. High blood pressure is a very, very dangerous disease, okay? You have to have regular appointments with your primary care physician, and if you do have high blood pressure, you have to have that treated. Our body is amazing. It's able to do amazing things if we take care of it. And one of those things is to hold off as long as possible before a person may have a stroke. But if it gets to a point where the body can't hold off anymore, that's when symptoms start to happen. And in stroke, if a person is having a stroke because of high blood pressure, you have to remember all the arteries in your brain are the same age. It stands to reason if you've had a stroke from one artery closing down because of high blood pressure, you may have other ones. And so it becomes imperative for a person to take care of themselves. So namely, like I said, high blood pressure, high cholesterol, and diabetes. All three of those have to be well controlled. Also, smoking is the single best thing you can do for yourself to quit. If you can quit smoking, it's better than almost everything else combined.
Okay. So strokes happen to young people too, yet many people don't think that they are at risk. The data shows that approximately 10 to 15% of all strokes occur in adults that are age 50 or younger. And kind of like you were saying, those risk factors that that cause strokes in older adults, like high blood pressure, high cholesterol, obesity, diabetes, those are causing increased incidences of stroke in younger adults. But we know that the research says that up to 80% of strokes can be prevented through healthy lifestyle changes and working with healthcare practitioners to control those risk factors. So what can younger people do to best prevent these risk factors from developing in the first place?
Well, like I said, regular health checkups are very important. Blood pressure isn't something you feel. You don't feel you have high blood pressure unless it's extremely, extremely high. So if you're not regularly checking up with your primary care physician, you won't even know. And in the era of COVID nowadays, we hear a lot about COVID, and we've been dealing with it for almost 2 years now. What a lot of people may not know is that COVID infections have been causing strokes in younger patients, age 30 to 50. Okay. And they come in with large, devastating strokes. They're otherwise healthy, and there's really nothing else going on except that COVID infection. And we've been seeing more and more of those come in now. I want to take this moment to remind myself and to remind everyone, if you have not gotten vaccinated, it is a very safe thing to do for yourself and for your family. I strongly encourage anyone who has not gotten vaccinated to consider doing that, because younger patients are having strokes because of COVID. Okay. But in general, what I would say is what's healthy for your heart is healthy for your brain. Okay. Moderate exercise, if your heart can tolerate it, eating healthy, making sure you have routine checkups with your primary care physicians, and really treating risk factors if you have them, especially high blood pressure, diabetes, and high cholesterol.
So like you said, there's a strong connection between our cardiovascular health and our brain health, and that what is good for our heart is good for our brain. What is good for our brain is good for our heart.
Yes.
So another question I wanted to, and you kind of, when you made reference to, for each of us, our arteries are all the same age, but one of the groups of people that are at greatest risk for a stroke are those people who have already suffered a stroke. That 1 in 4 heart attack and stroke survivors have another in the future, and many survivors are unaware of their increased risk. What should stroke survivors and caregivers be aware of to help prevent a second stroke?
Well, and again, that goes back to the comment of all your arteries being the same age, right? They're all under the same physiologic stress that you put your body through over the course of your life. Okay. And so the best secondary stroke prevention, aside from medications, which is what a stroke specialist will put you on depending on the type of stroke you had. Okay, all strokes, not all strokes are the same. Some types of strokes require full anticoagulation. Other types of strokes require antiplatelet medications and statin medications. Some types of strokes require only one antiplatelet agent, like aspirin. Others require 2, like aspirin and Plavix. And so really, for us here at St. Rita's, because we are subspecialized and this is our area of expertise, we will custom tailor make the plan depending on the risk factors and other variables that will decide the long-term care from a medical standpoint. Okay. From a health standpoint, again, I reiterate, what's good for the heart is good for the brain. Moderate exercise, if your heart can tolerate it, make sure you're eating healthy, making sure you're stopping bad habits like smoking or excessive alcohol use. All of these things can certainly reduce your risk of stroke moving forward, even if you've had a stroke in the past.
Excellent. Well, thank you for all of that insight. I want to ask a couple questions specifically about the care you provide at St. Rita's. And your stroke program has earned several awards and is highly recognized for providing expert care. Can you just kind of explain the range of stroke care options you have, and how that is treated in the community?
Sure. So we here at St. Rita's have the ability really to do a full gambit of stroke. So there are, if a person presents within the 3-hour window, we have an option to give them a medication called IVA, depending on whether they're eligible for that or not. Okay, and that significantly reduces the chance that the stroke will be permanent. But we also have the ability to do what's called mechanical thrombectomy, and I think we're the only center in the whole region that can do that. Okay, and I reiterate, time matters in stroke. Every minute, the brain is losing 2 million neurons with you vessel open. 2 million neurons. Wow. One of the things we do at St. Rita's is the team that is triage care of you is the same team that would do surgery if they need to do surgery, which is what I do. And that is like I said, a mechanical thrombectomy. What that means is we would put a catheter in the leg, come up around the heart, go up into the brain, and be able to pull that clot out in the right situation to reestablish blood flow to the brain. Okay. A lot of times, if you go to an institution that does not have interventional coverage, what they end up having to do is transferring to an institution that does. And by doing that, you're losing a lot of time. Okay. And like we said, if you calculate it takes about an hour to transfer you from one institution to another, you're losing about 120 million neurons in that process. Okay. And so our care really has custom tailor-made to effectively and efficiently take care of stroke patients, because we look at our process and we try to shave off minutes wherever we can. How can we do things better? How can we make things faster, safer? And that's really been our focus. And our focus really is on quality of care and taking care of patients like their family, because that's what we all, that's what we would want for ourselves.
Very, very helpful to know. And the only hospital in the region that's able to provide that treatment option is it's important to know that you'll receive excellent care there. So I did have another question about, I guess, in the community. One of the most important things with stroke is being able to connect with other people and support groups, not only for stroke survivors, but also for caregivers. Do you have any information on what stroke support groups are available in the community?
There are actually plenty of stroke care groups that are available, and I would also include the American Heart Association and all of the great work they do with not just stroke but heart care as well, because really this is a connected thing. Between the health for your heart and health for your stroke. On our end, I think if you contact the stroke department or the neurology department, they can give you certainly a list of different support groups that are available, both for stroke survivors as well as family, because stroke is a disease that doesn't just affect one person. It affects that person and it affects everyone around them. Okay, it's a profound effect. It's actually the number one leading cause of disability in the United States, actually worldwide. Okay, thankfully now we're the number 5 cause of death. It used to be number 3, but with all of the efforts that have been made over the last 20 years, we've pushed that number down, and hopefully we just keep working hard at pushing that number down, because it truly is a true statement when we say 80% of these strokes can be prevented. The problem is only about 5 to 10% of people reach the hospital in time. And that really speaks to the amount of knowledge that we have to put out into the community. Stroke is a time-sensitive disease. Don't waste time with it. Call 911. Family members. So I was giving that FAST talk I was telling you about, FAST, and we actually went out to grade schools and we were talking to kids about it. And we had a fourth grader that picked up a stroke in her grandmother and saved her life using FAST. She recognized the signs. She called 911. They came, picked her up. She was, her grandma was babysitting her. And she saved her life. And so these things are.
What a story. It's not complicated to understand, but it takes action. And like you say, time is minutes matter and seconds matter.
Yes.
And you kind of mentioned that, how stroke care has just been, exponentially improving over this period of time. And how has stroke treatment and care changed over time? What are the things that you were doing to improve outcomes so drastically, and what might be possible in the future in the community?
Well, I'll tell you, this is a very, very exciting time to be a stroke physician and to be a neurointerventionalist. Just in my lifetime, and from the moment, from the start of my training till today, the tools that we had when we started training, they're obsolete now. The stroke field is moving so fast that every year or 2 years we have new, safer, better devices on the market. When I first started training, we were still using the Mercy device, which is a device that, not to get too technical, but it was a device that would open a vessel about 50 to 60% of the time. Now, with the new stent retriever devices that are on the market that we're using and very proficient with, we're getting numbers of 80 to 90% ability to open a vessel, which is paramount important.
Wow.
And, at our institution, like I was telling you, we're a high volume center. And so we're very well versed and very proficient with all the devices on the market. We pride ourselves on being on the cutting edge of medicine, actually, for that reason. And incorporating these new, safer devices has just dramatically increased our ability to really take care of people and maximize their chances of coming back to normal and sending them home. My oldest stroke patient, by the way, was 103 years old. 103. She came in with a stroke. It was a devastating stroke. She wasn't able to move on her left side of the body. She wasn't able to really gauge where things were in a span. So she came in. We immediately triaged her. I took her straight to angio, the clot out, and she started moving on the table. And I will tell you, as a physician, that is why I do what I do. It is a very humbling thing to be a part of saving someone's life. It really is. I wouldn't trade it for the world. And she went home 3 days later.
That's remarkable. And thank you for the level of expert care you provide in the community. What a wonderful community asset. And it's just, thank you so much. So we talked about stroke prevention. We talked about risk factors. We talked about how to recognize stroke and the aneurysm. We talked about treatment options at Mercy Health St. Rita's. Is there anything else that you want to impress upon everyone that's important to know?
Well, like I said, I really just want to reiterate the mnemonic FAST, F-A-S-T. If you or a loved one's face is droopy, if your arm is weak, if your speech is garbled or jumbled, or you're not making sense, it's time to call 911. It's okay to be wrong. Let me reiterate, it's okay to be wrong, but it's better to be wrong than to be sorry. Don't waste time. Don't sleep it off. Don't give it time and see how things go. You come in immediately. The sooner you come in, the better chance you have of recovering. Because, a lot of times we're treating patients with the worry that this is going to be a permanent deficit for them. Okay, just the 5 minutes, 5 minutes, if you're talking about 2 million neurons a minute, 5 minutes is enough time for a person to lose the ability to swallow. And you can think about how profound that is forever. It's 5 minutes is enough time for a person to lose the ability to speak or understand. 5 minutes is enough time to lose the memory of a grandchild. Okay. And so when I say that, I mean it. Don't waste time. Call 911, come to the emergency room. If things turn out that it wasn't a stroke, you didn't lose anything. Okay. Don't take chances.
So when you say it's okay to be wrong, it's better to take too much action than it is to take than to be and then to not take action at all.
Absolutely. The stroke is one of those diseases where you cannot afford to waste time with it. Don't take a chance. Call
And if
911.
if you don't know, then you should take action if you're uncertain.
Okay, at worst, when you come in and it turns out not to be a stroke, you get a stroke we look at all your risk factors. We custom tailor a plan for you moving forward to keep you as healthy as you can be. So you really have nothing to lose.
Okay. All right. On that note, I think we'll kind of wrap this up for this part of the conversation. So, Doctor, thank you so much for all of your insight and your for all that you do for the health of the community. So, thank you very much for joining us, and we'll look forward to talking again in the future.
I appreciate it. Thank you all.